Welcome all attendees to the town hall, the first virtual town hall of Clackamas County Commissioners. We are going to get started in just about 30 seconds here while the attendee numbers fill out. If you're on the phone, thank you very much for joining us. You will have a chance to call in when I give the instructions to do so. So we'll be starting in just about, the attendee numbers are still going up, so 30 to 60 seconds here.
But we're on, so I can start with some opening comments.
Well, I'll go to you in a second, Chair.
Okay, all right, so I'm gonna eat.
Okay, and we're gonna get started in just about 10 seconds here. Thank you for joining us. Okay, and with that, we're going to go ahead and get started. Welcome to the first virtual town hall held by the members of the Clackamas County Board of Commissioners. I thank everyone for joining us today. I can see we've got 130 people in attendance, and that number is rising. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating the public comments for today's meeting. If any attendees would like to provide a comment, you'll be prompted to do so in a few minutes by me by utilizing your raise hand feature on Zoom. Your raise hand button is in the Zoom bar that's at the top or bottom, depending on your device. If you're on the phone, you can also hit *9, and that lets me know that you would like to give a comment. I see we have 10 phone-in listeners right now. Today's topic is the coronavirus pandemic's short-term and long-term effects on our community. This is a coronavirus town hall. Joining us, we have Clackamas County Chair Jim Bernard, Vice Chair Martha Schrader, Commissioner Paul Savas, Commissioner Sonia Fisher, Commissioner Ken Humberston, as well as County Administrator Gary Schmidt, Business and Community Services Director Laura Zentner, Health, Housing, and Human Services Director Rich Swift, and Emergency Operations Center Co-Commander Philip Mason Joyner. Today's town hall will go until 3:30 or until we run out of comments, but I'm not anticipating that. The session will be archived to YouTube probably later today, certainly by tomorrow morning. And with that, I'm going to pass it on to Chair Bernard to make opening comments.
I'd like to thank you all for joining us today. I think this will be something we'll do more in the future. It's a great way to reach out, give people an opportunity to talk to us during this unusual time. We have many challenges, but we got some great people working on it. Want you to know that we're coordinating with our neighboring counties. We're also coordinating with the state, and Nancy Bush from our disaster management coordinator is just practically on the phone constantly. Dr. Present, our health officer, is keeping us up to date, and I want to thank you for what you have done so far, and that is stay safe, stay home. Very proud of Clackamas County, frankly, for the work we've done to hold this virus at bay, but we still are not through it, and we have to be very diligent. And earlier today, we had the mayors on, and every one of them mentioned the fact that people are getting a little tired of staying home. They like to see businesses open, but that's a dangerous thing to do. And we're working with everybody to figure out how do you do this. This is the hardest part of this whole thing, is how do we do it, open back up for business and save lives. We're going to have to do it very carefully. With that, I'll turn it back to Dylan.
Thank you, Chair Bernard. I was going to give an opportunity for the commissioners to all give a quick opening comment if they want to. So Vice Chair Schrader, would you like to say anything?
Yes, can you hear me? Great.
Yes, yes.
So I think what I'd like to say is first, thank you, Chair Bernard, and thank you to all my colleagues, because this has been a fantastic team that is operating so well and so diligently with one another under really trying circumstances. So we are doing several listening sessions, and the first one that I did with Commissioner Savas, who I hope will make a few comments here, focused on local business and economic development and how we can spur our local economy, and what can we do to help our businesses, as we continue to react to and navigate this pandemic. Because the economy and prosperity for our citizens has always been kind of one of our main focus areas in this county. And one of our focus areas is obviously our strategic goal to grow a vibrant economy. So our Business and Community Services Department is here. They're working on a business recovery plan. Details are in the works, but I want to reassure our businesses that your county is not standing idle as we're moving forward. So, but what we need to know from you folks today, our citizens, is what are your concerns to your community and for yourself in facing a potential economic downturn, and how are you adapting to business closures? And we're interested in hearing your opinions and experiences with anything under the economic development umbrella. Thoughts on restaurants, major industries, just to name a few examples. So that's just one aspect of what we'd like to hear about. And I thank all of the citizens that have taken the time to be part of this town hall today. And I was going to turn it over to Commissioner Savas because he was with the first listening session with me on economic development.
Thank you, Vice Chair Schrader, and welcome everyone who's participating in our town hall this afternoon. Just to build on what Vice Chair Commissioner Schrader had just mentioned, yeah, we have we had a very hot economy up until here about a few weeks ago, and the whole country saw the brakes put on rather hard. We are very appreciative of all the landlords and so forth that are abiding by the governor's order for the no evictions during this period of time. That's important for both people who reside in their homes and also for businesses. I am very concerned about the sudden drop, all the unemployment claims. That's going to be a loss of revenue for the state and the county, and that translates into a lot of the services that we provide. So not only is this a major disruption for businesses and for families and for employees, and it is for government as well. So the impacts are tremendous. My goal today is to do a lot of listening. There's a lot of callers today, so I really want to hear. So I'm going to keep my comments really brief today, and we'll just try and field as many questions and input from you as possible so we know how to help you. So thank you, and I'll pass it on to my next colleague. Commissioner Fisher,
I think your Commissioner Fisher, I think your mic is muted.
Thank you, Commissioner Savas. Commissioner Humberston and I held a listening session regarding shelter, which was very valuable to hear from members of our community about what's important during this time of COVID-19. We have so far to go in making sure that we all do what we can to stay safe, save lives, stay healthy as a community. And it's incredibly important that every person in our community that is struggling has a safe place to shelter during this time. So just like we did during that listening session, I'm looking forward to hearing concerns during this listening session. I really want to hear what people are worried about during this challenging time, not only in regards to shelter, but in all needs that people are experiencing out there for family, friends, for vulnerable populations. And this board, we are committed. One of our main strategic performance Clackamas priorities is to ensure safe, healthy, and secure communities. And that is even more important during a pandemic than during our everyday normal lives. So we are committed to do that. We're in partnership with you. Hearing your concerns helps us in our roles as your elected officials to communicate that other elected leaders at the state, national, and city council level. So thank you so much. I'll pass it on to Kim Humberston.
Thank you, Commissioner Fisher. I don't have a lot to add to what's been said already. I think you've covered everything. And frankly, I'd like to save the time for the community to be able to talk to us and give the time to our professional staff to be able to answer questions at a more granular level. So I'm satisfied with what's been said.
Very good. Thank you so much to all the commissioners for that. And with that, we're going to get started. I see we've got 161 people in attendance. So now is the time to go ahead, and if you are on the phone, you can go ahead and hit *9 to let me know that you want to make a comment. If you are just watching via Zoom, you need to hit the raise hand feature, which is available on Zoom on the Zoom bar that can be at the top or bottom of your device, depending on what you are using. So let's go ahead and start. We will start it. The first one that we have is Maxine Marzolini. Give me a quick second, Maxine, to let you come in. You need to unmute yourself. If you could do that, and then great. If you want to ask your question to commissioners or relay your comment, if you could do it in, try to keep it to 1 minute. Thank you.
My comment is we are seeing a lot of success with the grocery stores, the banks, and the pharmacies that are doing the distancing and the mask wearing. Is it safe to assume we can open more businesses under that same paradigm?
Okay.
That is something that will be looked at.
Okay. Great. Anybody else want to respond to that one? Nope. Okay. Maxine, thank you very much for your comment. Next up is going to be Eugene. I'm going to say it's Fifield or Fifield. Eugene, you are on. If you can unmute yourself and then go right ahead.
Thank you, Dylan. Yeah, it's Gene Fifield. There's three things that we can do. One is let it burn through the population, and the other is mitigation. Slowly let people get infected, which is kind of what I think is what we're headed for. Just keep it underneath the hospital capacity. And the third that isn't being considered and talked about at all is lock it down and have containment. Kind of like South Korea has done, Taiwan, China, Germany, and next week, Massachusetts and the San Francisco Bay Area. And in order to do that, you have to do tracking and tracing. It's a public health issue. Is there any talk of that third option, or are we just racing back to business as usual and letting things get out of control again, possibly because we let off the brake too much? Okay.
Well, I could comment a little bit about that. First, we're not going to race back to business as usual. We have our professional folks. There's a task force that's looking at how to bring this slowly back. And I don't see locking down the county or the state or the country as anything that is really being considered. We're trying to keep it flat and safe and save lives. The task force is going to give us some ideas how we can open back up for business. There are businesses, for example, restaurants that may eliminate part of their half of their tables and stuff and keep the distance. There are businesses that the lines work, separating people 6 feet work, and I go to those almost every day. So we're not going to go back to business as usual and risk everything. And we have some very well-educated people. Nancy Bush, who is our emergency management manager, has experienced not viruses, but events similar. And she's working hard to make sure we do this correctly. It's the toughest part of the whole thing is going to be this part.
All right. Thank you very much for that, Chair Bernard. And I should add to commissioners, if I see a hand raise, I will go to you, but assume that we will only go to one response just to get through time, because I see we've got nearly 170 attendees. I'm also going to mix in the emails that we have received ahead of time. I'll probably do one email for every 2 live comments we take. So the first one is this from Kina in Oak Grove. I have a very serious concern I'd like to raise. I am a homeowner in unincorporated Oak Grove. Our home is on Oatfield near Park Avenue. Before the pandemic, we already had a speeding problem, but now with fewer cars on the road, some people seem to have forgotten entirely that this is a residential street with a speed limit. I see and hear motorists treating Oatfield like a highway at all hours, day and night. I understand that the police force is stretched thinly in our county, but this is an incredible safety concern, especially with no sidewalks and neighbors trying to walk to get exercise while otherwise homebound. Many of us on Oatfield are worried that horrible crashes are imminent. If we cannot get some sort of increased law enforcement presence, I have plenty of space in the front of my home for a photo radar van or speed radar sign. My neighbors and I have even discussed purchasing one ourselves if we cannot get support from the county, but we are not sure if that is possible. Thank you for your time. Yes, Chair Bernard. Or, so sorry.
I was just going to say thank you for the comment. The sheriff very well knows what's going on and is working to get more enforcement out there.
Okay, Commissioner Savis.
And just really quickly, next Tuesday, I believe we're going to have another town hall. The topic's going to be public safety and law enforcement. So, by all means, bring that comment, and if nothing else, Dylan, share that email with us then, and we'll try to respond then. I think Chair Bernard touched on it. We'll do our best to contact the sheriff about that. There's been a big ramp up in these kinds of instances, people speeding all around the county. So I know that they've been very busy trying to enforce it. So I live right off of Oatfield myself, so I witness what's going on myself. Thank you.
Very good, Commissioner Savis. Thank you for that. And just to state that I believe that listening session is slated for next Thursday. I think it's been moved to then. Commissioner Humberston, you had your hand up.
Yes, I just wanted to not to belittle the citizens' concern about the speeding, because I understand how serious that is. However, to put it in perspective, I want people to understand that the sheriff's 911 calls are up 43% over last year at this time. So there's some other very serious things that are going on in terms of more serious crimes. And I'm sure that is taking up a great deal of their resources.
Thank you. Commissioner Schrader. Oh, you're muted, Commissioner.
I just wanted to say that this is happening all over the county. We've seen speeding here in my hometown, Lake Oswego, on some of these back roads, and it's because people are pretty much, and actually even having a lot of red lights being run. So I think the answer, I don't know what the answer is, other than, again, let's try and help our law enforcement folks and our first responders, help with that traffic issue, because it's not just where you are, it's everywhere.
Very good. Thank you, commissioners. Next, we're going to bring in another call. Jeff Rubin. I will bring in Jeff, if you could unmute yourself. Good. And if you could go ahead and make your comment or pose your question now, if you could keep it under a minute. Thank you.
Thanks. Just curious from the EOC or commission perspective, what do you see as your greatest current and short-term unmet needs? And also, what degree are you able to do effective recovery planning in the absence of widespread testing? Thanks.
That's a really good question. My son, it's a really good question. I think that we follow the governor's guidelines. I think she had 6 measurements she wanted to measure. The challenge with testing is we don't have the supply. The other thing is Dr. President mentioned earlier today on another call, you could be tested today and get the and be okay and get the virus and the next day. So the challenge is, without the supply, without the assurance that the test is going to give you an answer, we just have to rely on the measurements. Folks who are diagnosed, either in the doctor's office or the hospital, and watch that. And we are watching that. I feel fairly confident. It's kind of like statistics. You just kind of base it on what information you have and come up with a curve that you can follow. Other than that, we're trying to figure out how to get through this with the task force.
Thank you very much for that. I'm also going to ask Philip Mason Joyner to respond, if Philip, you wanted to, with the question of the greatest need that we're seeing in the EOC. And of course, Philip is the EOC, or Emergency Operations Center Co-Incident Commander. Philip.
Well, thanks, Jeff, for the question. There's so many needs. You know, I think Clackamas County has done a really proactive job of making sure that the personal protective equipment that we do have, we're getting out quickly to our first responders, to our healthcare providers, and those organizations that are serving some of our most at-risk populations. So I'm thinking of folks in congregate settings like long-term care facilities and other some of our housing authority residents that really need those protections in place to be safe. That's been, just a huge lift to make sure a county of our size that everybody's getting what they need. We've also, in the past couple of weeks, set up a liaison team that's proactively reaching out to community-based organizations that are representing different populations, asking them and having daily calls with partners about what their needs are and seeing how the county can meet those needs. And then, the conversation like today, how do we begin while we're still in the midst of this response and we're still having, about a half dozen cases every single day and doing all of that disease investigation work, we're still at the same time preparing for recovery and what our community is going to look like getting out of this response, and how do we do that in a very safe and intentional way.
All right. Thank you very much for that, Philip, and thank you, Chair Bernard. And thank you, Jeff, for the call. Next, we're going to go to Jenny Doman. Jenny Doman, if you could unmute yourself, and you are on. If you could please keep your comment to under a minute. Thank you.
Okay, so I was just wondering if Clackamas County is going to offer an additional extension in regards to the moratorium on residential rentals. I know they've done that in Multnomah County, and I don't know if that's happened in Clackamas County yet. And I've in accounting firms, so I have clients who are renters and clients who are landlords, and they're both wondering what Clackamas County is going to be doing because Multnomah County has already made an announcement.
I would say that we're going to follow the, right now we did already eliminate our ordinance that did not allow evictions because we are now under the governor's order. So as long as the governor keeps that order going, we will also. I believe that's true.
Okay, very good. And thank you very much, Jenny, for that, for the comment. Next, another email question. This is from Erica in Happy Valley. I live with and take care of my mother. She is in her 70s and is medically fragile. I dare not leave the house other than getting essentials. Rent is currently 3/4 of our combined monthly income. I am a widow on a pension. Mom has Social Security. While management is great, the company is owned by a larger company. My question, are rent freezes being discussed? I mean a state mandated rent freeze. Eviction restrictions are a good start, but it doesn't create a healthy outcome for so very many of us living on the financial fringes. We need a safety net. We have to feel like our state has our best interest at heart. That kind of leadership isn't coming from the national level. Thank you for your time, and thank you for doing everything you can to help keep us in front of the problem.
I think that's a state question. We'd probably have to get back to you on that.
Okay, very good. The next call is going, or the next Zoom, excuse me, is going to be from Erica Nimeth. Erica, if you are there, and you can go ahead and you are on. If you can keep your comment to a minute, please. Thank you.
Thank you. And as luck would have it, actually, that was my email that you just read. Oh. Thank you for that. I will be on the town hall meeting tomorrow with Senator Ron Wyden. So I will ask that question as well. that's about it. I wasn't expecting that timing. I want to say thank you as a community member for what you all are doing and what our neighbors are doing. I'll leave it at that and appreciate your time. Thanks so much.
Okay, thank you very much. Oh, what are the odds? Okay, next is going to be, we'll go with Susan Listo. Susan, if you are on, you can unmute yourself, and then please keep your comment to under a minute. Thank you.
Ellen, Commissioner Humberston had a question.
Oh, I'm sorry. Commissioner Humberston, go ahead. Oh, you're on mute, Commissioner Humberston.
I just wanted to respond to the previous caller's comments. I think it was in the last long session that the state actually put a ceiling on how large the rent increases could be on any given year. But there's, to the best of my knowledge, been no discussion on any kind of rent freeze at the state level. They put a ceiling on the increases, but they didn't end the increases.
Okay, thank you very much for that. Okay, sorry, Susan Listo, you are up if you want to go ahead and pose your question or make your comment. Thank you.
Thank you, Mr. Blaylock. I really appreciate all the help that you have provided for the citizens, and I want to express my thanks and appreciation to our county commissioners for all that they're doing. I'm proud to live in Gladstone. We have a wonderful city administrator and Mayor Tammy Stemple. Our police force is excellent, and countywide, I've seen a lot of people being arrested for speeding and other traffic infractions. So I know it's being taken care of. I submitted a couple of questions that I hope you will ask sometime during this. Thank you very much.
Thank you.
All right. Thank you very much for that, Susan. Let's see. No. Okay. We'll bring in one more caller, and let's go with Ernesto Dominguez. Ernesto, if you are on, there we go. And please keep your comment to under a minute. Thank you.
Thank you. I just had a question of something that I've heard other states and cities doing, and I'm curious if it's something that can happen in Clackamas County. I have a number of friends, family members, and peers who are undocumented or who have DACA status, and they don't qualify for a lot of the stimulus programs that are coming from the federal government. I'm wondering if Clackamas County is planning to do anything to support these part of our populations who are still suffering, and I would argue more at risk than ones that are receiving other stimulus funds.
Laura, you guys had an announcement recently, economic development.
Yeah, thank you, Ernesto, for the question. We are working on a draft plan that will deploy resources through community partners to support entrepreneurs, small businesses, and minority populations. The draft plan, of course, has to be reviewed by county leadership and the Board of County Commissioners prior to being finalized. The plan will provide technical support, small grants, and micro loans for businesses impacted by COVID-19. And then longer term, we're looking at support for workforce retraining for those that are displaced by COVID-19. And some of the criteria that we are looking at includes businesses that are 10 or less employees, lower income, so we're looking at 80% or below the median family income, minority-owned businesses, and so those are just some of that's the lens that we are looking at. Again, those are not finalized. We're looking at grants that would be forgivable up to $1,500, and then again, we're going to be doing micro loans for businesses. Again, we don't have all the details worked out, but we are working as fast as we can to get that out, and it should be within a couple of weeks that we would deploy that information.
Thank you. I just want to add a couple of things. One thing is that Clackamas County, we get about 18 cents out of every dollar in taxes you pay. We don't have a business tax. We don't have urban renewal monies that we can support businesses like Portland can. So it is much more challenging. If we decide to, let's say, put $250,000 aside, I don't know where we would take that from. We're right now just focusing on the critical needs of our community, and we would have to eliminate programs to come up with that kind of money. So the economic development folks have really stepped up and tried to figure out a way we can do that. And they're challenged too, because lottery dollars aren't coming in. Normally, that's what we would use to support businesses.
Okay. Thank you for that. Commissioner Fisher, you had your hand up, and then Commissioner Humberson as well. But first, Commissioner Fisher.
Yeah, thank you. Yeah, I just was hoping that Philip could chime in here. I was at EOC yesterday, and one thing that I was really impressed with was our efforts during the crisis to have liaised to different populations. And there's an active effort to reach out to our undocumented in order to provide support. And so while Chair Bernard is right, we don't have piles of discretionary and flexible money lying around to provide a lot of financial support within our infrastructure and how we are addressing this crisis. We have definitely prioritized an equity lens and reaching out to a variety of populations.
Very good. Thank you for that, Philip. Did you want to respond?
Yeah, and I also, this is something that Rich and I talked about this morning is how do we make sure that we're hearing those voices and that it's a team effort and it takes partnership. And that's why that team is so important, to be connecting with our partners that are out in the community and working directly with folks. Or we all recognize that sometimes being a government agency is a barrier, and to have that trust, we need those partnerships. And Ernesto, if you can connect with us here at the EOC, I definitely want to make sure that you're formally looped into the team, and we can begin to chat more about how we can address specific needs that are occurring right now.
All right, thank you for that. Commissioner Humberson, you put your hand down. Are you okay?
Yeah, I'm fine.
Okay, very good. Okay, thank you for that, Ernesto, very much. Next, we'll take another email question from Melissa in Boring, who wants to know, will there be a county fair this year? Many kids have projects and money wrapped up in 4-H. It would be good to know if they should keep investing their money or figure out another plan. It would also help families plan in coming months.
I can take that question if you'd like. So I just attended the Fair Board meeting last week, and as of now, it is on. However, I will say that the Fair Board will need to listen to the direction from the state, from Clackamas County, Oregon Health Authority. I know they really want it to go forward, but again, they're going to have to kind of play it by ear and make a decision as information is made available from different entities. So no decision yet, basically.
Thank you for that. Commissioner Humberson.
Yeah, Laura answered the question. I was at the same meeting, so I don't need to say anymore.
Okay, very good. Thank you both. Okay, next we'll go to the calls again, or the Zoom. Laura Edmonds. Laura, if you could unmute yourself. And yep, there you go. And if you probably want to identify yourself, then there we go.
I will, thanks. Hi all, Laura Edmonds, CEO at the North Clackamas Chamber. Thanks for all of your guys' work and energy you're putting into this. As we're tracking so much when it comes to the business loans and everything, and I won't be redundant because I just heard Jim respond on the business, some of the funding concerns we have for the business community. So I guess one thing I heard this morning, and I would ask the county's assistance in this, it appears that OSHA might be getting active in doing some inspections at some of the manufacturing companies in the region. And based on that, they're issuing fines. And the challenge is that some of those manufacturers and companies that are currently open are having problem accessing PPE equipment because the lack of it in the region. And so they're doing everything that they can to keep all their employees safe and employed. But if OSHA is actively inspecting and fining, that's a little bit offensive given the situation that we're in. Also, everybody's been waiting for the Oregon Health Authority to put together their rules and guidelines. Those have yet to be issued. So it's cart before the horse. So if they have not issued their all of their full guidance, and yet OSHA is moving forward with inspections and fines, I would ask the county to help us to encourage OHSU or OHA to get those guides done before fines are established at the business communities. That's all I have. Well, it's not all I have, but for now, that's all I have.
All right, that might be something I could bring up tonight at the, wait, what day is it? Tomorrow night at the Tri-Chairs meeting. Maybe we should consider a letter. I'll bring it up. Thank you.
Thank you. Commissioner Savas.
Yeah, one of the earlier questions early on, it's probably going to be a recurring question. It kind of relates to this, Laura, but I think that the question is, when can we get back to normal? When can we start, businesses start opening up? And I was at the pharmacy yesterday, and I walked in, and there was signs that said, "We're out of sanitizer," and that even meant sanitizing stations. So that if you were to sign your Visa card or your thing for the pharmacy, they were literally out of sanitizer. So I think things like that, and face mask, and the general protections that anyone would expect in order to transition businesses and employees back to work, we're going to need a good supply of all that kind of material. So I think that will help place everyone in a safer condition and probably entice government to loosen the reins a little bit and allow that. I'm sure that'll be one of the criteria amongst others, but you know, we need to have a good amount of material, safety material, PPE, hand sanitizer, wipes, everything that's needed to create and maintain a safe environment for everyone. I think that's really what it boils down to.
Thank you for that, Commissioner Schrader. Oh, you got your mute on, Commissioner Schrader.
Trying to find it.
There we go. There we go.
So Laura, I have a question for you. So are these active manufacturing businesses in our county that are experiencing this? Or is it also regional? Do you know, are the other counties and other chambers kind of reporting this kind of a issue?
Yeah, Martha, thanks. We were on a state call and with the U.S. Chamber this morning. And
okay.
Yeah, this is being reported to us statewide that OSHA's taking these actions. So that's why we're bringing it up, because we just heard about it this morning.
Yeah. I do think that Commissioner Bernard usually talks to the other chairs of the counties every day. So I do agree. I think a letter mentioning this, because it's a fine line between keeping your, you know, when you want to keep your employees safe, but you have to be able to do business as well. So I think maybe that is something that we need to address sooner than later.
Well, one challenge, of course, is that there's been a lot of complaints that businesses are not following the rules. And normally they don't inspect unless somebody complains. I mean, in 32 years that I ran the business, I had one OSHA inspection, and that was because of ladders. So usually it's because somebody complains, but I'll talk to them about it tonight, see if they've heard anything. Thank you for calling.
Thank you, Laura, for calling, and thank you for the responses, commissioners. We are about halfway through. We still have 166 attendees with us and 7 or 5 raised comments, but I'll just go ahead and remind people, if you are on the phone, you can hit *9 to raise your hand. If you are on Zoom, you can raise your hand using the Zoom bar that's going to be at the top, or the raise hand function on the Zoom bar that's at the top or bottom, depending on your device. So we'll try to get some more here. Next up is Mitzi Bauer. Mitzi, if you could go ahead and unmute yourself.
Hi,
there we go.
Hi,
yep.
This is Mitzi. I'm a member of the North Clackamas School Board, and Jenna Benaloga is also on the call. And I really appreciate your offer to connect as partners. We have some immediate needs, and one of them right now that we haven't received any stimulus support for is our connectivity for all of our students. We have at least 700 students that cannot connect for the online education that we're supposed to provide. And we've gone through several different programs. They're very restrictive. Some of them don't cover all our students. There's lots of deals involved, but we could use some support on that. And maybe some of the online providers could offer programs that we have to commit for a whole year and would just be not as restrictive. So anything you can do for that. We also are providing 1,200 meals a day for our families, and that's something, another added cost. And who knows what else. I think mental health, as soon as we start to come out of this, will be even needed more than ever. We also have concerns about our budget. We don't know, with Common School Fund, that's not going to be there. So whatever you can do to work as partnerships, we appreciate. And thank you for the good work you are doing.
Thank you for that, Mitzi. Oh, Chair, if you're trying to say something, you are on mute.
I know yesterday or the day before we talked about Wi-Fi hotspots. Didn't we agree to move forward on that, Gary? Yes. And so that will take a few weeks, but we're going to put those on public buildings, I believe, perhaps schools. So kids could drive, or families could drive, let's say kids, and drive up and use the Wi-Fi hotspot. That's the one thing we're going to move forward on right away. And of course, we're talking about extending internet capacity throughout the county, but that's going to take many years. And Richard, did you want to add any comment? She asked mental health.
Sure. So mental health, actually just recently we stood up behavioral health unit as part of the EOC, and we're actually working on the development of Go teams related to mental health, structuring a system of both outreach and also allowing in-reach for those individuals who are experiencing crisis. You know, we had actually, we were working with the schools prior to the cessation of in-class education. And we'll pick that once schools return back to regular session, I guess in the fall, if that does happen. So we are actually working on behavioral health now. We're not actually waiting until this event is over, because we're seeing a lot of increased activity across all aspects of behavioral health in the county.
Thank you for that, Commissioner Savas, and then Commissioner Humberston.
Yeah, Mitzi, good to hear from you. It's been a while since we chatted. My question to you, back to you, just for clarification is, and knowing what school district you're in, is the people without the service relatively scattered geographically? It's really a matter of not having the service, but there's service available nearby. It's just a matter of they're not being paid or having the service at their home. Can you clarify, please?
Well, I would have to get back to you for sure, but I know I believe it's scattered across the district, and some of those are people that can't afford, some are on the cusp, and then there probably are areas. I would have to find out more about that and get back to you. I don't know if Gina has information on that. She's also on the call.
Okay, I do know the school districts have and been reading that they're doing all they can to provide connections and computers for kids to do distance learning. So we discussed that on Tuesday. And in the rural areas, it's really a problem, really a challenge. And that's where we focused, or assuming where we're going to do our Wi-Fi hotspots. But areas where there is service nearby, that's just an economic need, and perhaps we can find a way or even talk to the providers and see if they're willing to provide that service at no charge. We'll see what we can do.
Great, thank you.
Commissioner Humberston. Nope, you're muted. There we go.
Yeah, thank you for that last comment there, Paul. I just wanted to inform Mitzi that there's been 6 or 8 hotspot locations identified by staff. We haven't released that information yet until Administrator Schmidt says so, but staff are working to get this up and running as quickly as possible. That will help for some students.
All right, thank you very much for that, and thank you, Mitzi, for the call. Next, we will go to Gary, I'm going to say Marshke, maybe. We'll say that. Gary, if you can unmute yourself, and then You can, oh, I don't have you unmuted yet, but you can do it yourself if you have the opportunity to.
There we go.
There we go. Okay, great.
Hi.
Thank you very much.
Yeah, so this is Gary Marshke with NAMI Clackamas. Hello, commissioners. It's so good to see all of you healthy and well. And I want to thank you all for all the work that you're doing, both just to make our whole community safe, but also to support our folks with specific mental health challenges. I also wanted to let everyone know, since we probably do have more people than we did last time, at least on the call, that NAMI has online support groups available for anyone. This is anyone experiencing any kind of challenges, mentally, emotionally, or otherwise, with this isolation, social distancing, and crisis. And you can find them. There's too many for me to list. They're all on our website, which I am going to shamelessly mention, is www.namicc.org. There's lots of resources, as well as our support groups up online. It's especially good, the support groups are, because they're online and accessible for first responders, folks that are experiencing any of the frontline folks that are really experiencing the exceptional stress they're going through. Our classes will be online very, very soon. And the other thing I wanted to ask everybody, especially the commissioners, but everybody else, is there anything that we can do to support our community?
Thank you very much for that, Gary. Commissioner Humberston, you had your hand up. Oh, you are muted, sir. Commissioner, you're muted. Oh. Commissioner Humberston, we can't hear you because you're muted. No.
There we go. NAMI's doing a great deal to help the community in that vein. I'm just going to add one little thing, and that is if you do not have 211 on your phone, I strongly advise people to get that on your phone. That gives an incredible number of resources that are available for physical health issues, mental health issues, and a wide variety of other issues. So I encourage people to download that free app if they have a cell phone and take a look at what's available there for help.
Richard, did you want to add anything to that?
Missed the wrong button. As I spoke before, I guess if I interpret Gary's question correctly, I think NAMI does a lot for us already. They're a strong partner of ours in terms of the provision of behavioral health services in the county. In this event, as I said, we're in the process of sort of reformatting our current offering regarding behavioral health services. So I think by next week, we'll have our Go team set up. And I'm not sure that I actually have a whole lot more to add, except, thank you, NAMI.
Yeah, thank you, NAMI.
Thank you very much, Gary, for the call. Appreciate that. Next, we'll take another question from email, a popular topic that we got. Marty and Brian both wrote in about antibody testing. One of them wrote, I have more than a few friends who now think they might have gotten COVID-19, but were never hospitalized and never recovered. How can they get an antibody test to let friends and family who've been with them while they were sick know that they've been exposed to it? As this is a health-related question, perhaps Philip, you might want to go ahead first.
Yeah, so we know that antibody testing are becoming available through the healthcare system. We are, from an epidemiological perspective, we're interested in that. We think it will be a helpful tool in our toolbox, along with the additional strategies that we've been following, along with testing as well. I would definitely consult with your healthcare provider. We need to be cautious. We don't know all of these different tests, how reliable they are. This is a novel coronavirus, and there are other coronaviruses that are out in community. So the efficacy of this test for this specific virus is fairly unknown. And we want to make sure people don't have a false sense of security. So I think it's definitely worth talking to your healthcare provider about. And it's a tool. It's not the single solution to solve this problem.
Thank you, Philip. Chair Bernard, I'm sorry, I didn't mean to cut you off. Did you want to add something?
No, you're fine.
Okay, great. Let me see. Next, we will go to, I'll remind those on Zoom, we still have over 150 attendees. You can go ahead and hit the raise hand feature if you want to ask a question. And if you're on the phone, it is *9. We are going to go next to Lynette Lind Mood, maybe Lindy Mood. Lynette, if you want to unmute yourself, and then you are on. If you could keep your comment to under a minute. Thank you.
Hi, it's Lynette Linda Mood, and I'm a nurse, and I wanted to know if the county has seen any monies, emergency monies coming from the state level, which hopefully has come from the federal level. Have we seen, or can you talk and address about any money flow that has come from the feds?
Philip or Gary or Philip?
For public health, we have received some funding from the state of Oregon. That legislative session where they allocated some dollars to help with disease investigation, and then we have received some money from the CDC as well. Some of that funding was from the work that started in January when we were doing that additional work of folks with travel history from the affected areas of that time, and to receive additional funding to help support that. We've had to increase our staffing within our public health infectious disease time. Our workforce has doubled in order to stay ahead of the investigation work that we do, contacting all of the cases and all of their close contacts and folks that are high risk, and getting them connected to care and making sure they have all the education and guidance they need to protect themselves and their families.
Gary, did you have anything to
Yes,
add?
so the county has been earmarked for some state and federal dollars related to COVID-19. I'm not aware that we've actually received it yet, but we have been earmarked some dollars, as well as the states have received quite a significant amount of funds that will be distributed to the counties, and we haven't gotten that full amount yet.
Thank you. Commissioner Humberson?
I don't have any comment. Administrator Schmidt answered the question.
Okay, very good. Thank you all. We will go back to the emails that we received. We've got more comments waiting though. From Rebecca in Oregon City. What are each of you doing in regard to opening the state? For example, are you urging the governor to follow federal guidelines and safely open the state, or do you support the closure? If you could explain your communications with the governor. She also added, I am self-employed and do not qualify for any kind of financial assistance. Are those in county government still getting paid if they are not in their offices and not 100% available to assist the public during this shutdown? We'll take the first part first. So about what is Clackamas County essentially doing as far as communicating with the state in terms of leaving stay healthy, stay safe, or advocating for something else?
Well, we're advocating for whatever works. So there's a task force that is working to determine when we open businesses and how we open businesses and what kinds of businesses open. We're going to follow the state of Oregon and the advice of our professional health people. And as far as our employees working, we have many employees working, volunteering around the county, and that's about as much as I can answer. Thank you.
Okay, very good. We will go back to the Zoom, as it were. Julie Hugo. Julie Hugo, if you could go ahead and unmute yourself, and you are on. If you could keep your comment to under a minute. Thank you.
I will certainly try. In address to the OSHA comment earlier, I do work for a local manufacturing company, and OSHA is taking complaints from all businesses on concerns. And I think it's above and beyond safety concerns. I think they're personally concerned just being out in the public. And from a business standpoint, I think that can create a lot of noise as businesses trying to keep the safety and security of our employees first and foremost, as well as doing business. But also we're doing a lot of COVID activities within our organization. I'm going to take off my business hat and put my personal hat on. Is there anything in the future as far as wanting to help as a a concerned citizen of Clackamas County to help the local businesses and companies, be it manufacturing or services, to say, hey, this is local, buy from this company to support those businesses, because, you know, as all of us, our heart is here, we want to buy local. And then I have another question about more of a comment, not necessarily a question, but I know the unemployment system is very antiquated, and we're seeing that in effect now. I just got off the phone with my daughter, who is a Clackamas County resident. She was furloughed for 2 weeks, self-isolation, and had applied for unemployment. And I asked her if she'd heard anything, and she said no. So she's back to work. That's good, but she was off for 2 weeks. So I'm sure there are others in her situation where she has no connection with the unemployment. So that is very concerning to me, because I may be in that same boat in a week or a couple months. I don't know what that looks like. So just a comment there. But the question I did have was about the local business support. Is there any actions or plans there?
All right, thank you for that, Julie. Commissioner Savas.
Yeah, thanks for your question, Julie. I would direct you to the Chamber of Commerce. Laura Edmonds had just called in. She's the CEO. They are in total touch with a lot of businesses and probably have enough, I won't say consensus, but at least an idea of some of the trends and needs out there that a number of people can reach out and help or patronize businesses that are active today, and or maybe just need help. So when they do open the doors, or allowed to open the doors, we can patronize them to help them recover as fast as possible. But if there are several chambers, but the largest one in Clackamas County is the North Clackamas Chamber of Commerce. And that's why I refer you best to get that feedback. Thanks for your question.
I would like to add that, that's a good comment, and something that I definitely think that our folks will look at, how we can promote Clackamas County again. As you may or may not know, tourism revenues are gone, and it's going to take a while to recover those revenues. And that was one way we promoted businesses, but our communications people, our quarterly magazine or newspaper we send out, I think that's a good point and something we ought to do. Thank you, Julie.
Thank you very much for that, Julie. We'll go ahead and go to another email question. Larry writes in, thanks for the opportunity to ask questions. One that has really been asked a lot in my neighborhood is, we continue to hear there is a shortage of supplies of PPEs and our hospitals are being overrun. How can that be if we only have a little over 1,500 cases of coronavirus statewide? As this is a health question, I will direct it first to Philip.
Your mic, Philip.
Okay, there we go. Sorry about that. Thanks for the question. Yes, PPE is of concern. It's a national issue. It's a global issue. Just our supply chains are stretched like they've never been before. And I think, we have plans and we do exercises, and we're prepared as a county, a region, and a state for all sorts of emergencies. But the magnitude of this pandemic, I don't think any of us would have imagined that we're where we're at today. And so that's, just one of those factors that plays into our inability to respond. And priority absolutely is our healthcare. Those workers that are in direct contact with suspect patients or cases, making sure that they are safe and well protected. It's not something that locally we can very easily solve, but we're working every day advocating to get the supplies we need. And, we have done a great job in Oregon flattening our curve, and we're seeing cases. We're still continuing to see active cases every day, but our hospitals right now are managing things. and we are okay right now in terms of our hospital capacity. It's something we monitor every single day, and we have regular calls with our healthcare partners on that.
Thank you.
Thank you for that, Philip. Next, we'll go back to Zoom. Karen Walker. Karen, if you can unmute yourself, and then you are going to be on. Oh, you have not unmuted yourself again. Karen Walker, if you were there, there you go. Okay.
Hi, everybody. Thank you so much. And I've got a few questions in regards to where we are with the COVID problem in Clackamas County. I mean, according to my research, we've got 150 cases and 3 deaths. But we've got 420,000 people in our county that half of them can't work because of this. Do you really feel that it is so necessary for us to continue to shelter in place and do all these efforts when more people died from the flu last year than what's affected in our county?
I say that the work that we've done to shelter in place is why we are where we are. Clackamas County, the oldest county in the state, was also the first to sign an emergency ordinance. And I think that's what it's called, emergency order. And it's true that Clackamas County's been diligent in keeping the numbers down, but only are the numbers down is because we are diligent in what we're doing. Over the Easter holiday, folks got together, and we expect a spike. It can take 2 to 3 weeks for that spike to happen. We're going to have to watch for that and see what happens from that Easter holiday, those events. And hopefully that will give us some indication what could happen should we open up too soon. Hopefully there are no cases. But Philip, you might have a little more handle on this issue than I do. I'm sure you do.
I think that was so well said. It looks like Rich wants to say something.
Okay, Rich.
So the comparison here in the question, as I understood it, was between the flu and COVID-19. I think one of the things to differentiate between the flu and COVID-19 is the rate of transmission. So the rate of transmission related to COVID-19 is about 3.1, maybe 3.3 in terms of one individual having the potential to affect that many other individuals. The flu was about 1.1 to 1.2. So that is why it was so important for us to shelter in place. What that meant was you were reducing the number of people potentially affected over time. So if we had let this run like we let the flu run in the country, the numbers infected would have been astronomical. And also it's important to remember that with the COVID-19, we do not have a vaccine. We do have a vaccine for the flu every year. Some years it's more successful than others, and in some years we do get more deaths from the flu. However, and the math actually with COVID-19 was utterly accurate in terms of projections, unfortunately, in terms of the exponential rate of potential infection. So that is why the shelter in place is utterly so important, because actually it's not really an accurate comparison. It's more apples to oranges to compare the flu to the current COVID-19. Thanks.
Thank you for that, Rich. We'll go to Commissioner Schrader, and then Commissioner Fisher, and then Commissioner Humberston.
I just wanted to say, I know it's stressful to do physical distancing, and I know that it's been difficult for businesses. However, I really believe, based on the science and the expert advice we get from our public health officials, this is the only way that we can, other than washing hands, watching how you cough, really kind of maintain this virus, keep it at bay. The big issue is it's a totally unknown virus. There's no vaccine. I think Rich just said that. There is no way to to really stop it. And unless we do this, and I quite frankly think we made an excellent decision. And I am someone who's very pro-business and wants to see businesses succeed. However, you've got to balance that with what could really be a tremendous loss of human life. I have family in New York, for example. Things are very grim there. I have a daughter in England in isolation. Things are pretty grim there as well. I have a daughter in Boston. All of my daughters with children. It's very grim there. We are fortunate that we have taken action in a way that hasn't put us into those same situations that some of those other populations are in right now. And I do feel very, very strongly about it. And colleagues, I'm going to apologize for 1 minute. I am going to have to try and switch over to a different computer. So you won't see me for a few minutes, but I will be back shortly.
Very good. Thank you, Commissioner Schrader. Commissioner Fisher.
Yeah, I just wanted to mention, along with everyone else, that, and Rich mentioned it as well, that if we didn't do social distancing the way that we have done, the growth would be astronomical. And I'm going to try to show this graph. I'll see if it'll work. Does it work?
No.
No,
You're
sorry.
gone.
Oh, maybe it will. Right.
No.
Darn it. Darn it. But it's a graph with the latest projections. And so how we've been going, it just barely is going up. But if we stop the social distancing and went back, the curve goes like this, and you can see how incredibly spiked the number of cases would be if we stopped went back to pre-March 22nd levels of social distancing. So we just have to get a handle on this until we have other options, such as more testing or the antibody test to show, or we just need more stability before we can step out of this.
Ken.
Commissioner Humberson. Yep.
There. I was waiting for Dylan.
Yep.
It's also inappropriate to compare this to the flu for another reason. The fatality rate for the flu is about 0.02% overall. The fatality rate for this particular disease is about 3% overall, and as certain populations are impacted, it goes up higher than 18%. So if you're elderly with a pre-existing condition, if you are in a communal living situation and situations like that, the risk is exponentially higher that you would die from this disease. So it is not synonymous with the normal flu. And as has already been pointed out, we don't have vaccinations. So speaking as one of the county commissioners, I will always err on the side of saving people's lives. And I agree with my colleague, Martha Schrader, that we made the right decision.
Thank you all for that. And thank you, Karen, for the question. There's still time to call in. We've got a little less than 20 minutes left. If there's comments out there, if you're on the phone, again, it is *9, or you can raise your hand via Zoom if you have a question. We'll go back to the emails. Stanley writes in light of the coronavirus and in regard to the high unemployment rate, will the county be making concessions in regard to paying property taxes in November?
That's yet to be determined. Like we've said before, that is our only form of revenue for the county, and the impact of reducing property taxes, or we might consider extending the payment time, maybe, but we're going to be discussing that. Right now, like I said earlier, out of every dollar you pay, the county gets 18 cents. And 18 cents, is a small part of the taxes you pay. And anyway, that's about all I have to say. Gary might have something.
Yes.
Gary?
Yes, that is a state law, commissioners, which the governor would have to either do a delay or a postponement. Counties and cities can't make that call on their own. That would be a state decision by the governor.
Okay.
All right, thank you very much for that. Next, we are going to go to Vince Liu. I'm sorry if I'm mispronouncing the last name. Vince Liu or Liu, if you could unmute yourself, and then you are going to be on with commissioners. Looking for Vince, still do not have, there we go. There we go.
Hi, good afternoon, commissioners, and good afternoon, directors of public health and emergency preparedness. So my question is regarding how can we as citizens and as Americans help, specifically with regards to supplying solutions of COVID for tracking for communicable diseases, for public health, or in terms of FEMA, CDC, or Governor Brown's funding in terms of tracking that feedback loop for services provided. Are there any considerations given for kind of software companies and folks who design that level of software to give back and help during this crisis? Is there a need for that?
Philip, do you have comment? You don't have to.
Well, I was thinking if you're with technology and you have a 3D printer, we need more homemade masks and gowns and things like that. So that's one thing. We've really not seen a whole lot of donations of homemade masks, and those would go to good use, especially for a lot of our vulnerable populations and those social service providers that are doing food delivery and providing services for those populations. So that would be a huge help right now. In terms of other technology, I'll have to think about that.
Okay, very good. Great, thank you both for that. No hands, okay. Another email from Salman GH. Do we need testing centers in Clackamas County? I'm sorry, I'm not sure if we've talked about this before. I don't think so. Philip, that might be best directed toward you to begin.
I'd love to be put in a situation where we had enough PPE and test kits to set up drive-thrus and have testing stations. We do not currently. I know some of the health systems are working and developing plans to be able to do that for folks experiencing symptoms. But right now we're not able to very easily stand those up. I also wish we had a vaccine right now, but we do not.
Right. Okay, very good. Let me see, and we've got a couple more calls. Again, if you want to call in, it is *9 for those on the phone, or raise your hand on Zoom. I think Gene has another question. We'll bring him in and then finish up the emails that we've gotten. Gene, go ahead.
Yeah, I appreciate that Oregon has done such a fine job in keeping this down. And this isn't just another flu. It's deadly for certain populations, and I'm probably in one of them. And some of the commissioners are probably the same place. No, not you, Jim. You're healthy as a horse. Anyway, the tracking, when to leave things up. But really, my question is for Philip. How many people will you need when you do get the test kits and are able to do tracing? Because what I think is going to happen, we're going to be trying to figure out how to modulate this. What is effective? Right now, the only way we know what's effective, like Jim Bernard said, is a couple of weeks later, people show up in the emergency room or they die. So we're flying blind, and you're bringing the helicopter down through the fog here. And until we get testing, this is a public health disaster. Now, we don't know the mitigating the 6 feet apart. Is that really going to work? And how well, and someone coughs in the air and you're in the same room. We really don't know that, and because we can't test. Philip, what are you doing right now to prepare for that?
Thanks, Gene. Really appreciate your insights and thoughts there. There's a lot of different tools. The governor's framework is a helpful starting place for us. We were on the state call with all the local public health officials this morning. The state is looking at we'll need, in order to do the level of contact tracing and disease investigation work, if we gradually open up the communities and the economies. We'll need at least, they're saying right now, 500 additional public health workers to help with just that alone across the entire state of Oregon. So what that means for us locally, I'm not sure yet. We're going to have to figure that out. Testing and vaccine development is something we're also keeping our eyes on. Don't have a time frame yet for those things. I am really thankful for our community. We do manage in public health our local medical reserve corps of volunteers, which are licensed healthcare providers that we can reach out to and have them come and help. So when we do mass testing or we do mass distributions of medications or vaccines, we've had over 125 in the past couple of weeks, folks that signed up, filled out applications, and really have stepped forward to say that when it's time, they're ready and they want to help the community. So that's just huge for us to have those folks engaged and want to help make a difference. We're just not quite ready to tap that resource at this point.
Philip, I had to walk out of the room. You did mention that we are actually tracing, and we have folks that are tracing contacts now sufficiently.
Yeah, we are. And because of the physical distancing and the work that we've done in Oregon, we've had an increase through temporary staff, gone from 7 staff now to about 14 that are working with us, and they're able to do all of that work. But it is 7 days a week. It is a big lift, but it's happening. I know a lot of places around the country haven't been able to do that. We're fortunate that we have.
Thank you.
Thank you for that. Again, we're in the home stretch, the last 10 minutes. There's still time if anybody raises their hand on the Zoom bar, or if you're calling in to go ahead and hit *9. We'll get to some of the last email questions very quickly. Philip, looks like another health question. Vani asks, how many respiratory therapists or other first responders have died caring for COVID patients in Clackamas and Multnomah counties?
None that I'm aware of, and I'll just leave it there.
Okay, very good. Laura Edmonds, you are calling, you have your hand raised again. So Laura, go ahead and unmute yourself if you have another question.
I am going to cross this line and ask the question. So Gary and Laura Z, probably you two are the best for this one. So Gary, you mentioned the money earmarked from the state funds that are going to be coming. So do you guys have an estimation of how much you're going to be receiving? And then also at what percentage of those incomes are going to be earmarked or that revenue specifically to helping small business through the recovery efforts? Because as we look at the current status with the PPP funding running out this morning, the idle funds are locked up because the SBA system is completely fractured. And the UI unemployment benefits right now, the PUI specifically, that are supposed to be earmarked for independent contractors and gig workers, that system has not been fully developed for those independent people to be able to apply at this point in time, therefore not even getting the extra $600 kicker. So we have a bit of a gap right now, and small businesses are falling through that. So when that state funding comes in, how much is going to be earmarked for small business? And then what is your timeline right now for distributing those monies to be able to get the help to those businesses that are falling through the cracks right now?
I'll start. This is Gary. I don't know the exact amount we're getting from the state, but it is very specific on how we're allowed to spend it. So we are allowed to reimburse expenses that we are currently spending county general funds on for the impact, such as operating our emergency operations center, for PPE equipment, for other essential functions of dealing with the crisis here at the county. We are spending considerable amounts of general fund and other programmatic funds that were not budgeted to address this pandemic. So most of that state money, by the law it was created, is earmarked for those specific purposes. However, that could lessen the impact to our existing funds that we then could reallocate for business support. But Laura Zentner, as she mentioned earlier, does have a plan in economic development to address some quicker needs to support the business community. So that is where I think we could have the best impact.
Go ahead, Laura.
So to add to what Gary said, we have earmarked $500,000, 300,000 of which will go to our small grants and loan program. 100,000 we're going to partner with Clackamas Community College and Clackamas Workforce, again on retraining and redeploying workers who are displaced. And then the other 100,000 is for that the business recovery plan, and we're going to be working in partnership with the EOC and our Health, Housing, and Human Services, and that's going to be earmarked for, again, the recovery plan. So that's a little bit longer term. So hopefully that's helpful.
Thank you very much, Laura, or Director Zentner, and thank you very much, Laura Evans, for the question. It looks like we're at 3:25. We have time for one more call, and then I'm probably going to go to closing comments from commissioners at your discretion. It is a follow-up question, I believe, from Karen Walker. Karen, I'm going to bring you in, but you need to unmute yourself. So go ahead, and if you can keep it to under a minute, please. We do not have much time.
Oh, of course. Can you hear me now?
Yes, yes.
Awesome. So I did have a few other questions regarding the cases and what's going on in our county. But I'm very curious. Do you guys have like an estimate on how many people in Clackamas County were tested for COVID? And okay, just answer that question and I'll be good with that.
Okay, thank you. I guess Philip.
Today we have tested, and this is on the state's website, close to let's see, we have 142, it might be a little bit more up to date now, positive cases, and then negative tests, 2,892 is what I have here.
Thank you. Commissioner Savas, you have your hand up.
Yeah, I just want to add, Karen, if you were to go to the Oregon Health Authority website, you'll find what the information that Philip's just citing. They update it every day, usually in the late afternoon. I look at it thoroughly, and you can see all the counties in there if you hit the demographic button. But if you look at the large counties, the small counties, all 36 counties in the state of Oregon, I think per capita, we've probably fared very, very well compared to the larger counties because of our early action that was taken. But yes, the number as of yesterday was 142 people were tested positive. And as Philip said, 2,892, but that'll be updated here in about an hour. We'll have some new numbers, and it's updated daily. So I would encourage anyone listening to just look at that. When you get on the landing page for Oregon Health Authority, at the very top, you'll see a colored COVID notice. And if you actually press on that, it'll take you into the demographics in that particular page. That's all I have.
Thank you very much, Commissioner Savas. Commissioner Humberston.
Yes. I get, like the rest of the commissioners, I receive the situation stat report every day, and I post the stats on a variety of Facebook pages, but you can also go to clackamas.us. There's a red banner at the very top, and that is the banner for COVID statistics in detail. Go there and you can track what's going on specifically and quickly and easily in Clackamas County.
Thank you very much for that, Commissioner. Okay, I see we only have a few minutes left. I'd like to toss it to the commissioners now. If anybody has any closing comments, just put your hand up and we can get to you for about 30 seconds. Any sort of closing thoughts for the audience, of which we still have about 100 people. Or maybe not. Oh, Chair Bernard, you're,
Oh, I'll go ahead and go. Okay. And that probably won't take 30 seconds. I just want to say thank you to everyone on the call, everyone asking questions. These questions are very useful to us, and I really appreciate your engagement.
Thank you. Commissioner Humberston, I think you had your hand up.
Yeah, Commissioner Fisher pretty much took the words out of my mouth. I really appreciate the fact that we had that many people actually tune into this. And the number of participants was great. Learned a lot about what is concerning people, and we will do everything we can to protect people. And obviously, like everyone else, we want to get off of this and open up our county again as soon as possible, but we're going to do it in as safe a way as possible. Thank you for your participation.
Thanks, Laura and Rich and Gary and Philip and you, Dylan, for the work you're doing, and people for just logging on and listening to us. Our staff's wonderful, hard at work. One thing I'd like to add is it's pretty amazing that our development wing, in a matter of 3 weeks, got our applications for development online in 3 weeks. After I heard somebody mention Portland's been trying for 5 years and spent millions of dollars. Pretty proud of that, that they were able to do that. And I want to thank all you commissioners for the hard work you do. It's endless. I am kneeling on the floor because I have sat in this chair since 8 o'clock this morning on conference call after conference call. And thank you all very much.
Thank you for that, Commissioner Schrader. There we go.
I just want to ditto what everybody else said. Thank you. The staff has been fantastic. It helps us do our job. I want to give a shout out to our IT folks, actually for me in particular, because my internet has not been the best. And so they've been over here helping me. If you heard a little bit of noise in the background, it's because we're setting things up. So I should be able to come in loud and clear from here on out. But I just want to thank our citizens. Thanks for staying home. Thanks for physical distancing. Stay safe. This is an unprecedented time in the history of our country and the history of Oregon and the history of our county. This is going to go down in the history books, much like I think 1918 did, in terms of how we've managed it and how we handle it and how we recover from it. And we have talked quite a bit about recovery today. And I do want to let our constituents know that's going to be front and center when all of this, when the curve gets flattened down to zero. We can only hope. So again, stay home and stay healthy.
Thank you very much for that. Anybody else, or are we going to be?
I'll jump in.
Okay.
Just want to again thank everyone. Don't want to be too redundant here that participated. I'm hoping that actually the next one we can do like in the early evening, so we can hear from the people that work from 8 to 5, and also they can actually participate as well. They don't have that opportunity. Of course, they can go to the recording and maybe we can cite that. Let people know that these are obviously recorded, and then they can play them back. But I certainly want to hear from the workforce out there that is dealing with the situation today, and I think that input would be valuable. And be safe and be healthy. Thank you very much.
I have concerns about doing night ones. Which night is that? I mean, I am on a phone call every night. I'd be very challenged to find a night that I'm not on a phone call at 5 o'clock. So anyway, thank you.
We will.
See you next time.
Yeah, we will look into that. Thank you very much to the entire Board of County Commissioners. Thank you to Administrator Schmidt, Director Zentner, Director Swift, and of course, Incident Co-Commander Philip Mason Joyner. As Commissioner Savas referenced earlier, we will have a listening session with members of the board focused next Thursday. Details to be released, but focused on law and justice and concerns over law and justice in the county with the pandemic. We have a guest from the district attorney's office and probably one from the sheriff's office. But again, details to come on that. We will plan on holding another town hall probably 2 weeks from today, but you can continue to check the Clackamas County website on that. So for everybody here at Clackamas County, thank you very much.
Thank you.